Schizophrenia is a specific mental condition which is impairing very often due, let's say, orientation in the real world. The different symptoms, but very often our typical symptoms are that people are hallucinating, they optical and also hearing voices, that people are have a different self-perception. So very significant changes in your in the way you're experiencing yourself. The important reason, so about in the normal population, about 1% of the population experiencing schizophrenia or schizophrenic symptoms. It's a disease which is most of the time is not, let's say, a chronic condition. A lot of people recover from it. So what we normally say is one third of the clients are having an episode, and then they're stable for the rest of their life, especially if they get good treatment. One third have relapsing conditions, so they have an episode now and then, and one third has some chronic course, have on hearing voices on an ongoing basis. Okay. So that's a rough description. I think it's always important to understand, if you dive into the understanding and the history of a mental illness or a mental condition, you will be able to understand why things happened and what led to a certain crisis. It's not like someone is waking up and is crazy with no burden and no background and no history to it. So, and in the media, what I think very often, psychosis, schizophrenia, and whatever hearing voices and all of that is often described as something which is impossible to understand. There is no rationale behind it, there is no functionality behind it. I don't think so. I think there is very often a functionality behind that. And if you, for instance, go back in your personal development as a kid, kids very often have behaviors like imagine to be big and invincible if they, as a response to being anxious in a situation. And you can compare that to also a psychotic individual that they sometimes use voices or alter egos to strengthen themselves, to cope with severe anxiety, and specific symptoms which are associated with schizophrenic disease, like paranoia, are extensive anxiety. And what people try to do is they try to explain their own anxiety and build big systems around them, not to be seen as stupid and crazy and doing all kinds of weird stuff. So that's how I would summarize. I think, and that has again also something to do with the very stigmatized way media and also the public perceiving mentally ill. Unfortunately, severe mental illness, especially psychosis, is very often only reported on if there are violent incidents of any kind. So, or if there are something weird is happening, and then mentally ill and psychotic individuals are presented as being more violent, and you have to be careful to interact with them and stuff like that. So that is also if you look on a population base, if you look into the research, that is not probably the percentage of psychotic individuals which are violent is not much bigger than the percentage in the average population. So, and I would really appreciate if there is more conversation and also presentation about, for instance, psychosis in a positive way. Give you an example. There was this really nice film about a Nobel laureate, A Beautiful Mind, which showed how creativity and productivity sometimes goes along also with very sensitive individuals in that case, which were, despite their psychosis, very, very productive and unique. And if you look into the history of art, same thing. You have a lot of very, very creative and gifted people which are experience times of psychosis or bipolar disease, but are extremely productive artists, like Van Gogh, for instance, or others. So I would like to see more public awareness also about the strengths, and also they are special, but nobody needs to be afraid of mentally ill. So normally you have different strategies. So you have the whole range of options in pharmacotherapy, and then you have a whole range of psychosocial interventions, and third, you have supportive structures which help, or self-help, or peer support, or that. So ways to structure your life which improve your situation. So there are all kinds of effective and proven intervention. I think that what I would see important is that you especially have someone who is working on you on an ongoing basis. I think you need a stable, I think that's very important, you need a stable relationship, therapeutic relationship, someone who is looking after you, a good psychiatrist or a psychologist or whatever, and helps you to cope with the ongoing challenge of being extremely sensitive and sometimes very anxious and respond different to stress. So I won't go into the, unless you want me to, into the different arms, but I would more say, if you are in trouble, what helps you? So what helps you is a stable relationship, and it's a therapeutic relationship where a person is taking care of you and is there for you if there is a crisis. Second is you need someone who's really helping you to resolve problems you have. That means not only talking about the importance to have a nice home and a good job and to be successful in your job or in school, but also someone who is giving you advice or helps you to be successful in school, or actually to survive in your job, or to manage challenges. So real help, stable relationship which is trustful and empathic. And then I think the opportunity of self-reflection is very important, to learn and to improve your skills in coping with mental challenges. Those are really three, in general, very important things to bear in mind if you suffering from mental challenges.